Hello everyone, today I'll be taking another VivaLive session with QQSphere on the subject of psychiatry on the topic psychotic disorders, and the subtopic will be dopamine hypothesis. So let's start.
Welcome to the examination. Today we will be discussing psychotic disorders, particularly the dopamine hypothesis. To begin, could you explain the main premise of the dopamine hypothesis regarding schizophrenia? Please note that this discussion does not provide medical advice or diagnosis. For any health matters, you must consult a healthcare professional.
The dopamine hypothesis says that schizophrenia stems from excessive dopamine in the mesolimbic pathway, which causes positive symptoms like hallucinations and delusions, and deficit dopamine in the mesocortical pathway, which causes the negative symptoms like withdrawal and apathy.
That's a good summary of the classic dopamine hypothesis. Now, focusing on the positive symptoms, can you describe a scenario featuring auditory hallucinations? What might a patient say or experience?
I don't know, can you please explain that?
Certainly. In auditory hallucinations, a patient might perceive sounds, most often voices, that don't actually exist. For example, they might hear voices talking about them, giving them commands, or providing a running commentary on their actions, even though no one else can hear them. Does that make sense? Now, moving on, what is the primary pharmacological management for such symptoms? And can you name some common antipsychotics?
Typical antipsychotics, D2 antagonists, treat positive symptoms but cause severe EPS, while typical antipsychotics, D2 or D5, HT2A antagonists, they treat both symptoms with fewer motor side effects.
You've described the general mechanism of typical and atypical antipsychotics, differentiating their side effects. Just to clarify, atypical antipsychotics also tend to have less motor side effects, as you mentioned, often due to their serotonin 2A receptor antagonism. Now, given the potential side effects, what is the importance of family education and social rehabilitation in management? Wait, you said D2 or D5 HT2A antagonists for atypicals. Atypicals are primarily D2 and HT2A antagonists, not D5. Could you elaborate on the family education aspect?
No, I don't know. Can you please explain?
Family education is crucial because it helps the family understand the disorder, recognize signs of relapse, adhere to treatment, and provide a supportive environment. Social rehabilitation focuses on regaining skills and integrating back into society. Now, regarding the legal aspect, what are the general procedures for involuntary admission under a mental health act typically?
I don't know that. Can you please tell me?
Involuntary admission typically requires medical certification stating the person is a danger to themselves or others due to their mental illness, and that treatment is necessary and cannot be provided voluntarily. There are also legal safeguards and review processes involved. This concludes our examination. You may now leave.
Thank you.
You're welcome. All the best.